I'd just like to say thank you, Anita, for the intro and for sharing my slides. I really appreciate that. I'm working from one screen, so I don't have the ability to do multi things.
So are you able to see it?
Yes, thank you.
Okay, perfect. Okay.
Okay, thank you, Tamsin, and it's so much information. It's so great to hear what's happening there. And now I'm going to focus on the other side of the spectrum, looking at heat alert response system within a rural perspective. Next slide, please.
Yep. There we go.
Great. And so within Interior Health, we acknowledge that we're collectively gathered on the traditional, ancestral, and ceded territories of these 7 Interior Region First Nations. Our region is also home to 15 chartered Métis communities. And it's with humility that we continue to strengthen our relationships with First Nations, Métis, and Inuit people across the interior. And today I'm calling in from the traditional, ancestral, and ceded territory of the Secwepemc Nation, also known as Kamloops. Next slide. So knowing that there are folks from all over the province on this call today, I'd like to further situate the interior BC, recognizing our vast geography, including the many rural, remote, and First Nation communities. So we have about 54 unique First Nation communities, 59 municipalities, 10 regional districts, and you can see here we have many communities with very small populations. Next slide. And so my goals today are to share what heat planning and adaptation looks like within a rural context in the interior. And I'm going to take a really high level in the presentation. And if you would like more details from the village of Ashcroft, I can share out contact information afterwards. And secondly, I hope to spark some ideas about how you might be able to support heat adaptation resiliency in the rural communities that you serve. Next slide. So why focus on heat in the interior? So heat's identified as the leading cause of illness and death from all weather-related hazards in Canada, as described by Health Canada. And the southern interior is one of the hottest regions in Canada and BC. And you can see with this chart, although it's a bit older now, represents the maximum temperatures for the month of July for the hottest communities in BC between the years of 2011 and 2018. And the orange lines represent the communities located in BC's interior. I would like to acknowledge at this point that the devastating wildfire in Lytton last year that happened days after they broke the record for the hottest temperatures ever recorded in Canada, which further highlights why these conversations and action around extreme heat adaptation, mitigation, and community planning is critical for community resiliency. Next slide. So to kick it off, I wanted to quote the new report out, Health of Canadians in a Changing Climate, Advancing Our Knowledge for Action. So heat illness and deaths are preventable and adaptation measures can be effective in protecting Canadians. Next slide, please. Okay, so these are the 5 major components of a heat alert response system, also known as a HARS. And it's important to recognize that implementation of HARS may not look the same in every community and is definitely not a one-size-fits-all approach. But we believe that the process and elements associated with developing a HARS may be applicable to different weather and climate-related planning processes. And so talking about the demonstration project in the interior, in 2018, Interior Health embarked on a multi-year project with funding from Health Canada to support planning and response to extreme heat in rural and remote communities. Next slide, please. So developing a HARS in the interior region of BC required a different approach, as existing tools and recommendations often target larger urban centers. And these approaches may not be applicable in rural settings where resources and capacities are different. So our HARS planning began with identifying a pilot community, which was Ashcroft, BC. And this community has a population of just over 1,500 people. and is located in the Thompson-Caribou region, as shown on the map. And as you saw earlier, it is one of the hottest communities in the interior with a dry and semi-arid climate. Interior Health has well-established working relationships with this community. As well, the village staff and council were enthusiastic to participate in the project, especially given the high number of seniors. And they had previously experienced a devastating wildfire season. I believe it was a year or two before we approached them. Next slide. And so the process began with community mobilization and engagement. So our medical health officer and director of healthy communities and myself went to the community on several locations or several times to present to council and to have conversations with the CAO and other staff. And then we supported and collaborated with the village to introduce heat response planning using community-driven and strengths-based approach. And this involved developing a multi-sectoral community stakeholder committee to help guide the project. And it was comprised of local and regional government partners, so the village, regional district, emergency management BC, public health representatives, community members and organizations, including nonprofits, volunteer coordinator, fire chief, a community paramedic as well, and surrounding First Nation band members. And then several community engagement sessions were hosted with the stakeholders to share information about extreme heat and the effects on health, identify population within their community who they thought were more vulnerable to heat, and then discussing unique contexts, including existing assets, and that was both around social assets as communication assets and infrastructure as well. That would help them prepare for extreme heat events in the future. And then the discussion around stakeholder roles and responsibilities within this, and what could each of the stakeholders do to respond to heat, and what types of plans could they put in place within their organizations to reach their clientele and their colleagues and their networks. Next slide. So Ashcroft uses existing heat alert thresholds established by Environment and Climate Change Canada and the BC Centre for Disease Control. And you can see here that in the southern interior BC, the heat warnings issued when temperatures are at or above 35 for 2 consecutive days, and overnight temperatures at or above 18 degrees Celsius. And this alert triggers the activation of the community response plan within Ashcroft. And additionally, Interior Health also monitors these alerts for surveillance purposes, as well as providing informational support that Ashcroft may need. Next slide. So the community response plan utilizes existing partnerships, physical and communication infrastructure to support the community and individuals in taking action. And the level of response from the community depends on the anticipated length of the heat event, and the increased length of the event results in higher risk to the population. And as such, HARS can be tiered by creating different response levels. So in Ashcroft, the plan is tiered into those 3 stages. And so the preheat notification is when temperatures reach about 30 degrees, and that includes pamphlets and different communication mechanisms. And then you can see on the figure on the right, and that's the flow of actions that the village takes when that advisory comes into play. And it's really around public messaging related to the prevention of heat-related illness. And then there's a level 2 heat advisory. And that's when they notify the population that there's going to be extremely hot temperatures for 3 consecutive days, and that the health of the population is at a higher risk. And the messaging really aims to protect those who are most susceptible to heat-related health problems. And then in the level 2, some additional actions look like opening cooling centers and providing information around more information or where to seek information. Additionally, Ashcroft uses a protocol checklist. So this is a very simple and concise plan, and as you can see with the flow diagram, and protocol checklists of who does what internally. And they also have pre-established printed and digital notification templates, so they could just change the date on templates, get it out to the post offices, get it out to the stakeholders, and get it onto their social media as well. So it's a really streamlined process that they've created. Next slide. So communication methods and activities, as I kind of illustrated, are embedded in the community response plan and activated prior and during the heat events. Many different methods, paper copies to the post office, to the post boxes, advisories, signs in parks, use of social media and web-based messages. And this is also where health plays a role in communicating public health, like the most current public health messaging around heat and actions to take, and being able to funnel that information to not only the public, but local governments who could then use that if they have a HARS, or get that on their social media so that the outreach is that much greater. And you can see, you probably can't see, it's very small, but some of the key messages within their communication is around who's vulnerable. And another interesting piece is they mentioned, please take time to talk to your neighbors and identify residents who require assistance during lengthy extreme heat events. And they go on to describe what to look for, like those who don't have air conditioning or have limited transportation options. They show what the heat illness symptoms are, and perhaps where to seek resources such as a cooling center or more information. Next slide, please. So evaluation is a key component of HARS to ensure the plan's working effectively for the community. And it's encouraged that HARS are reviewed annually to identify areas of improvement in the communication methods and activities. Post-event, post-heat session assessments of this HARS has taken place. And then an evaluation plan is in development to assess the timelines, relevance, and effectiveness over a longer period. Ashcroft has initiated or activated their HARS in 2020. 2019, they actually didn't have any alerts. 2020, there were 2, and then last year there were 3. Okay, next slide. Okay, so lessons learned. Within this process, communities play an important role in preventing heat-related illness and death through coordinated planning and action, getting all the relevant players to the table, and leveraging people's networks and reach. It was imperative that the plan be simple, concise, and considerate of the unique context of that community, and that was loud and clear during the engagement sessions. That's what we heard from everyone around the table. As well, educational materials and a tailored method of dissemination were important for collective and individual risk mitigation. And lastly, considerations for developing HARS in rural communities. So things to consider is the exposure to heat stress, community capacity and strengths, cooling centers, and cool outdoor areas, especially given during COVID. The cooling center wasn't able to open Ashcroft, so then they turned to what's available outdoors that's cool, and other places. Engagement and communication channels, special populations to consider, and competing priorities and emergencies as well. Next slide. Activities underway in the interior. So these are activities that our healthy communities and population health teams are engaging in. So with largely funding from Health Canada, we are pursuing targeted engagement with Indigenous communities on extreme heat planning. That's very, very new and preliminary right now. And we continue to support interior communities wanting to do short and long-term heat planning. provide community partners with that practical information and resources that can be used when developing and implementing strategies to respond to extreme heat. We're conducting some post-event assessments of the heat dome in the Central Okanagan and Ashcroft. And we are building off of Vancouver Coastal Health and Fraser Health's community health and climate change maps. So we have interior health and regional maps in development currently to help raise awareness and start conversations about the impacts of climate change on health. Next slide. And these are a couple resources. You can see on the left, just published is more information. So all the information I spoke about today and even more detailed information can be found in this article, development and implementation of a heat alert response system in rural British Columbia. So you can Google and check that out. And then the very well used, from what I hear, heat alert response planning toolkit for interior BC communities, which was informed by this work we've been doing with Ashcroft and other rural communities in the interior. Next slide. And lastly, I just want to acknowledge that this work and the learnings we are gathering are contributing to the evidence base around extreme heat response in a rural context, and would not have been possible without these partnerships and people who joined us on this exploratory journey to seek out locally relevant strategies to prevent heat-related illness and death. With that, next slide, I say thank you.